Welcome to this Whole Life Action Hour. I am Ocean Robbins, and I am so glad you are here right now. We're going to focus today on how to overcome chronic illness. Chronic conditions like heart disease and type 2 diabetes and obesity and dementia are the world's leading causes of death. They cost the global economy trillions of dollars, and they cause so much suffering as well as death. We have today perhaps the fattest and the sickest population in the history of the world. We're living longer, but we're also living more sick. And many of us look forward to aging with mixed feelings because we so often associate it with more and more prescription drugs, more and more suffering, more and more pain, and more economic burden on our families. But the truth is, something else is possible. A whole new possibility is emerging, and an overwhelming body of research tells us it works. We can practice lifestyle and diet choices that can radically change the outcome and shift the course of our destinies. And so today we're going to look at that. We're going to look at what you can do to prevent, even in some cases to reverse, most of the major chronic illnesses that are so epidemic in our world today. And we have the perfect person to do that with. We are here today with Dr. Saray Stancic. She's a triple board certified MD, certified in internal medicine, infectious diseases, and lifestyle medicine. She is the author of What's Missing from Medicine: 6 Lifestyle Changes to Overcome Chronic Illness. She is the founder of Stancic Health and Wellness, one of the first lifestyle medicine practices in the United States. She's also the producer and the co-creator of the hit documentary film Code Blue, which highlights the practice of lifestyle medicine to prevent, treat, and manage chronic illnesses. And she is currently chief medical officer for a new startup that is seeking to shift the healthcare paradigm. Saray's passion for lifestyle medicine is rooted in her own life experience. She's living with multiple sclerosis. She has achieved some extraordinary results in that, and that has helped her to feel very personally and tangibly the impact of all that we're talking about today. Saray, please let me be the first now to welcome you, and thank you for joining us.
Thank you so much, Ocean. It is a great honor to be joining you today to talk about this all-important topic.
Fantastic. Well, we're so grateful to have this time with you, and I think we always have to start with your story, at least briefly, because it's so significant, and let our audience know how you came to lifestyle medicine in your own life.
Sure. So my story begins 25 years ago as a young medical resident. I was diagnosed with multiple sclerosis abruptly on one evening. I woke up and I couldn't feel my legs. And that really changed the course of my life. I largely became dependent on more than a dozen medications, and about 8 years into the diagnosis. And mind you, throughout this time, I was compliant with all of my conventional medicine recommendations. My disease progressed and I was largely dependent on a cane. And it was then that by chance I came across some literature that discussed the connection between multiple sclerosis and diet. And that catalyzed this insatiable appetite to learn more and more about this nutrition topic that regrettably I hadn't learned in medical school. So as I empowered myself, I made changes in my own life, and I was able to taper off of every one of those medications, leave the cane behind. And today, 25 years since that diagnosis, I'm medication-free, disability-free. And this is why I'm so empowered to share this all-important message, because we can all do this.
So would you consider multiple sclerosis or the symptoms of multiple sclerosis to be in some way a lifestyle impacted condition?
I think in large part it is. Of course, there are genetic components, and we're not really quite sure what is the inciting agent. There are a lot of theories as to what triggers multiple sclerosis, but there has certainly been an understanding and awareness that there are risk factors that promote the development of disease, like obesity, smoking. There are theories that saturated fat. Roy Swank was one of the first physicians in the 1950s to propose that saturated fat might be playing a role in the evolution of the disease. And so I think there's a lot we can do to reduce our risk of disease, just like any disease, heart disease, diabetes, autoimmune disease, any autoimmune disease, Alzheimer's disease. And I think multiple sclerosis is no different. Regrettably, mainstream medicine has yet to catch up to this. So we're not really talking about this in the world of neurology, and MS specialists regrettably aren't speaking to it as effectively as I'd hoped they would. The treatment for multiple sclerosis today is primarily centered around what we call disease-modifying therapies, and these are medications that affect your immune system, that quiet your immune system, and they have been shown to have some efficacy. Of course, with any medication, there is a side effect profile, so that's something that we have to be very aware of.
Yeah. In general, lifestyle medicine seems to be kind of a catch-all for all sorts of conditions.
Yes.
And I often use the metaphor, if you drive your car into a brick wall, your death certificate might say impalement by brick wall, but the truth is it was bad driving. And if you're driving drunk all the time, we don't know which brick wall you'll crash into, but the odds are you'll crash into something at some point. And the truth is that the modern lifestyle, with the standard American diet and all of the lifestyle factors, too much sitting, too much smoking, too much saturated fat, too much unhealthy eating, too much stress, not enough sleep, etc., is kind of a recipe for one or another chronic condition. It seems like if it's not fueling dementia, or then it's heart disease, then it's cancer, then it's type 2 diabetes, then it's excess weight, then it's brain fog. All of these things kind of go together. Is that how you see it, that functionally, at the end of the day, the same lifestyle and diet recommendations that are good for one of these are good for kind of almost all of them?
Yes, absolutely. That's the beauty of lifestyle medicine, right? This prescription is the same regardless of what the diagnosis is. And I think that it's an important point that you're making, that these lifestyle behaviors are so important in the prevention of disease. And yes, it may vary in regards to what disease we develop. Maybe, for example, I developed multiple sclerosis, someone else might develop breast cancer, or someone else might develop Alzheimer's disease. But at the end of the day, it's the same inciting agent, right? It's this really poor lifestyle that we regrettably in our country often engage in. And that's when our genes play a role, because each and every one of us has a genetic predisposition. So when we engage in bad behaviors, we're going to turn on those bad genes that are unique to us.
So there are 6 lifestyle changes that you're calling for.
Yes.
To overcome chronic illness. Let's just go over those at least briefly so we kind of have a map of the terrain. Okay.
Yes. So in my book, I use the analogy of a wheel, and I like to use the wheel and the spokes. So there's 6 spokes on that wheel. And the reason I use the wheel is because they're all interconnected, right? It's diet, exercise, sleep, stress management, addressing substance abuse issues, if there are any, and then the importance of social interconnectedness. And the reason I use the wheel is because it's so important that we address all of them. Some of us may be really good at diet, but then we ignore exercise, or we sleep ineffectively, or maybe we drink too much, and that plays a role in promoting disease. So in order to achieve our best self, or what I call the sweet spot, it's important for us to address all aspects of lifestyle.
Yes, thank you for that. And I would add also there can be positive feedback loops. Like I noticed that when I exercise well, I'm more tired at bedtime and I sleep better that night.
For sure.
And so when we eat well, our body's lighter and we have a little more capacity to exercise, but just because it gets a little easier doesn't mean you don't still have to do it, right?
Right. But you're absolutely right. They are interconnected in that fashion, because you're right. If you exercise, you're likely to sleep better. If you don't drink, you're also likely to sleep better. And when we eat well, we're more likely to exercise. So yes, these are all good behaviors that sort of go together.
So substance abuse isn't something we've talked about a lot in our work. And so I'm kind of curious about you're making it one of the 6 there. Now, people talk about smoking and alcohol. Those are the main substances of choice in our society today. But are there other addictions or substances that you think are also problematic that you see widely used?
Well, certainly and I address in the book, the recent opioid epidemic. That's been a huge problem. But also within the context of that chapter, I talk a little bit about supplements, because supplements can be a problem. And this is a multi-billion-dollar industry, and we really don't have overwhelming evidence that it really plays such an important role in disease prevention. And I think so many of us are eager to invest because it's that mentality, take a pill and feel better. So if we take all of these supplements, then we can go out and eat poorly and engage in bad behaviors. I had an experience personally with supplements early on because I had read a book that talked about adding supplements to add an edge. And so I decided that I was going to take those supplements, and I actually had a very bad outcome. I developed something called drug-induced liver injury, and I was hospitalized because I was taking these. People don't realize that supplements are in many ways a medication. They have to be metabolized through the liver. And sometimes the average American doesn't understand that, and that could lead to some trouble. So when it comes to supplements, just be very careful. Make sure that your physician or your healthcare provider is aware of what you're taking, because sometimes they can interact with other medications. So it's just introducing a level of awareness that taking a supplement isn't just like taking nothing, that there's no risk involved. There is. Yeah,
absolutely. And interestingly, far less risk with any food, right? You can get a lot of nutrients from foods, and you're generally going to find them with cofactors and in a kind of symphony that makes it less problematic.
Absolutely.
Generally, although there are some exceptions, like heme iron, for example, right?
There are definitely exceptions, and there may be indications for supplementation, like B12 supplements or vitamin D. I live in the Northeast, so we don't get enough sunlight. But these are discussions that you should have with your physician or your healthcare professional. Don't just go out there and purchase, a boatload of supplements and expect that that's the solution to the problem. The solution to the chronic disease epidemic, this very complicated chronic disease epidemic in which we find ourselves today, Ocean, is really so simple. It's these simple aspects that we're talking about today. Eating a diet that is primarily plant predominant, moving every day, assuring that we're addressing those streams of stress in our lives, sleep those 8 hours. If you're drinking too much, be very mindful about how much wine you're pouring into that glass and how often you're pouring it. And then social connections are so important. When we're isolated or depressed, that promotes chronic disease formation, and we die prematurely. So engaging in those loving connections is again a little bit of medicine.
Yeah, thank you for that. I've often reflected that loneliness can kill faster than cigarettes.
Absolutely.
More predictably. When people feel lonely or isolated, life expectancy drops way down.
Absolutely. And we've had a tough year this year with the COVID-19 pandemic, and we've been so isolated, particularly our senior population. Yeah. So it's important for us to find opportunities to reach out to folks, if not in person, by phone call or by Zoom or whatever way you can, but making sure that there are those streams of communication that are active.
Yeah. And just a reminder there, love, I believe, transmits across all space instantly, like faster than the speed of light.
I agree.
I don't know quite how that works, but I think it's true.
It is true, and it is all powerful, and it is part of the medicine prescription, right?
Yeah, absolutely. Good. Thank you for that. Well, we got a lot of questions from our Whole Life Club members, so I'm going to jump into some of those now. Barbara said, this is a rather broad question. Is the Western lifestyle and diet responsible, and to what extent, for the coronavirus deaths? Obviously, it's not the total reason. However, it seems to me that there are so many deaths, not due to lack of wearing masks and social distancing, but because our population and those around the world following us are basically unhealthy to start, and thus have a difficult time fighting off such a virus. Here's an example of the opposite. I'm 81, and my high school gym teacher is a healthy 98 years old. He got the coronavirus, was ill for a few days, but not terribly ill. He got over it easily and is fine now. He's physically active, eats well, loves life, and has avoided acute and chronic diseases and medications.
Well, I love that. That's beautiful. Certainly, the chronic disease epidemic, the background, and then we have the acute infectious contagion, COVID-19. Certainly, this intersection has been profound. And we learned that early on in June of 2020, when the CDC informed us that those of us living with a pre-existing chronic illness, right? If you had one and then you were infected with the virus, that you were 6 times more likely to be hospitalized and 12 times more likely to die. So undoubtedly, those who have the most serious courses are those that are living with a pre-existing chronic disease like hypertension, obesity, chronic lung disease, heart disease. And so I hope, Ocean, that the silver lining as we get through, and hopefully we're on the other end of this pandemic now with vaccinations, and the disease seemingly appearing to be better controlled now, that the silver lining and the learning from all of this is that it results in an awakening for our country, that it's important and it's time that we all become much more mindful about our lifestyle choices. And I think it's regrettable, though, that authorities in the field at the level of the federal government have really missed an opportunity to bring more attention to this connection between the chronic disease epidemic and the acute COVID-19 pandemic and how it's played a role in increased morbidity and mortality. So moving forward, I hope this is something that can be really projected to the American public, because this is a golden opportunity for us to create meaningful change across our country.
As of this recording now, the Centers for Disease Control and Prevention has nothing about nutrition on their website with regards to COVID-19.
Yes.
The only exception is there is one page where they are essentially trying to discourage use of supplements, and they briefly mention food sources of those items. That's it. Nothing about chronic disease. And they've shared the data.
Yes.
They released the data showing that people with chronic conditions are far more likely to be hospitalized or die. I believe they also said 94% of all deaths were tied to pre-existing comorbidities. And yet nothing, not a word about food as a way to address that. And I think that's kind of a tragedy.
I agree.
But I guess the good news is that people like you are showing us what's possible, and this could become another catalyst for people to address issues that we've needed to address all along. It's striking that the United States has 4% of the world's population, but 20% of the world's COVID-19 deaths, and has now, I believe, passed Mexico again as the fattest country on the planet. And for anybody who's suffering from a chronic condition, my heart goes out, and we all realize there's increased vulnerability now. But the good news is there's something we can do about it, and that's why we're here today. Absolutely.
We're here to empower and educate and create change. And I thank you for all the work that you and your father are doing to help promote this.
Thank you. Nellie asked, is it possible that rheumatoid arthritis could have been triggered by diet? My husband suddenly had pain in his legs and hands. A rheumatologist said that he might have inflammatory arthritis. I've tried to modify his diet to be what is considered to be healthy. However, my husband finds it difficult to believe that diet helped to create his problem. I wonder if I'm trying in vain to correct his health issues by modifying his diet.
Well, I think, as we said early on when we first started our conversation, all chronic diseases are going to benefit from an optimal lifestyle. And I believe that, yes, there is evidence at the end of the day that all of these behaviors that promote inflammation can trigger all types of chronic diseases and autoimmune diseases like rheumatoid arthritis. Again, autoimmune diseases, there's a whole, I think there are about 85 different autoimmune diseases under that umbrella, that including MS and rheumatoid arthritis, lupus. These are the most common ones. But there is definitely evidence in the literature that our dietary choices and our sedentary behavior are all promoting these increase in autoimmune disease. In fact, there are 3 leading theories as to why we're seeing so much more autoimmune disease in the past 3 decades. One of them is obesity. One of them is psychosocial. So the fact that we're so stressed out. And the third one is this idea that we're so, because we live in this world and you might recall this, Ocean, when we were kids, we would play outside in the dirt, and now we protect our kids, right? We Purell them. And so that's the infectious theory, that we're not exposing ourselves to enough, infections as children. And so our immune systems are in many ways immature, and that might be promoting some autoimmune disease. But so much of what we're seeing today is largely connected to our poor lifestyle choices.
We heard from April, who said, "Hi, Dr. Stancic. I wonder how to help prevent minor back pain from becoming more disabling in life." Do you have any thoughts about minor back pain?
Well, minor back pain, it would be important to understand her history and understand what exactly is going on. Often it's carrying too much weight, or there may be some, orthopedic issue that is the inciting agent. So it would be important to know a little bit more about her history. But I think getting active and maintaining a healthy weight, it goes a long way to addressing some of those inflammatory issues that might be promoting back disease.
Got it. So activity, any particular kinds of activity that can be beneficial? Is it just about the circulation, or is it about muscle movement that's also important?
It's all of it. And the best activity is the one that you can do and the one that you're willing to do, right? That's the best answer to that question. So for the individual who's just largely sedentary, hasn't done much, it's just about taking a 5-minute walk and starting with that, and then capitalizing on that and building on it. I think so many of us, when we decide, and we often do this at the beginning of the year, our New Year's resolution is, I'm going to get into great shape, I'm going to run a marathon. And we go from sedentary, and then day one, we want to do that 30-minute walk or that 30-minute jog. And it doesn't work that way. We have to start out slowly. I know we want everything to happen overnight. That's sort of our society. We want the quick fix, but it's really about being patient and consistent. That's the key to success.
Yeah, thank you. We heard from SD, who said, how to overcome illness when there are hereditary hypertension, allergies, asthma, and heart disease issues. I guess also asking how to overcome chronic disease relating to menopause and hormonal imbalance. So two things really here. I suppose if it's hereditary issues, it's still the same dynamics, right? But maybe you can talk a little bit about how it changes when there's genes or family patterns, and then also menopause and hormonal imbalance issues that might cause chronic disease.
So genes, of course, play a role, but lifestyle always matters most. And I think that's what the science of epigenetics has told us, that regardless of our genetic predispositions, that our everyday choices play such an important role, because we can actually turn genes on or off. If you look at an example of identical twins, they have the same genetic material, right? So if you had two identical twins and one had, let's say, rheumatoid arthritis or multiple sclerosis, the likelihood that the second twin would have it is about 20 to 30%. So that tells you that it's not all genes, that there's so much you can do to either turn that gene on or off. So I think the good news is that, yes, of course, there will be hereditary issues that may play a role, but the most important thing you can do is engage in these healthy behaviors, because then you can actually turn those genes off and have better, more favorable outcomes.
Yes. Thank you for that. And what about overcoming chronic disease that might relate to menopause and hormonal imbalances?
So menopause and hormonal imbalances, it would be important for you to see your obstetrician or gynecologist to make sure you get hormone levels to address what's happening. But often, I have to tell you, Ocean, so many women who I see who come to me with that type of complaint, when you drill down and you take a really thorough history, you find other reasons. And you can correct that, and the patient will have improved quality of life. Yeah.
Okay. Thank you. What are some of those reasons that you might find?
Well, they might have an underactive thyroid. They might have an iron deficiency anemia. They might have some depression. Mm-hmm. There may be other issues that are going on that may be missed. And so it's important, and it's important to do a comprehensive physical exam mm-hmm. and blood work to assure that we're not missing something.
Yeah. What do you see? Because we're working on an article right now on thyroid function, and you just mentioned it. Mm-hmm. What do you see as how do you approach if someone has hypothyroidism or elevated thyroid stimulating hormone levels? How are you going to tend to approach that?
Well, it would be important to understand what the etiology of it is. Is it Hashimoto's? Is it an autoimmune component? And then if the patient has an underactive thyroid, we would prescribe a medication to replace the thyroid hormone. That's the way we would manage.
Right. Yeah. Got it. Yeah. So do you see diet or lifestyle factors being significant in thyroid health in general?
I think diet and lifestyle is significant in everything.
Yes.
We certainly would not just prescribe thyroid replacement in a patient with hypothyroidism and not fully address lifestyle and diet, because it's so important that we make this point. Patients will come to see me for their obesity, their hypertension, their rheumatoid arthritis, and that's fine. We're going to address all of those. But guess what? When we implement the lifestyle medicine prescription, we're also going to not just treat your rheumatoid arthritis, we're going to reduce your risk of breast cancer. We're going to reduce your risk of Alzheimer's disease. We're going to reduce your risk of depression. We're going to improve your overall well-being, because that's the goal here. Yeah. Ocean is for each and every one of us to age gracefully, free of chronic disease, right? And at the end of it all, on the last day on planet Earth, at age 102, right? We spend a beautiful day with family and friends, and then we go to bed and we pass away peacefully with dignity and some joy. And that is so important, because we all have the capacity to do this. We do not have to end up in an ICU or in a nursing home suffering. Yeah. And it's not only the individual that suffers, it's the family who has to witness their loved ones suffering that also has to go through that ordeal. So if you won't do it for yourself, do it for those you love.
Yes, thank you. So true. And, it strikes me as this contrast that with most pharmaceutical drugs, there are side effects. Yes. And often people then need to take another medication to deal with the side effects of the first medication. And this is why the cascade unfolds, and the average senior in the United States is taking 12 prescription drugs in any given year. But at the same time, sort of on the flip side, when you practice lifestyle medicine, you get positive benefits. The side effects are actually good ones, yes, right?
Exactly. Isn't that a beautiful thing? So the prescription that we're offering is actually offering additional benefits, allowing you to increase your likelihood of aging gracefully and not being dependent on those myriad pharmaceutical agents at the end of life, as you just pointed out. Every one of those medications, regardless of what its efficacy, it's going to have a side effect profile. And the more medications you are on, the more likely you're going to have drug-drug interactions and additional complications.
Yes, thank you. We heard from Debbie, who asked, currently I do aerobic exercises 6 or 7 days a week and yoga 1 or 2 times per week. Do you have any suggestions to help with Parkinson's? Any suggestions for allergies to grass and dust?
Well, Parkinson's, there's been actually a lot of evidence in the literature that exercise is important in the management of Parkinson's disease. I would add some resistance training to her regimen. I think you said she's doing aerobic and some yoga. You can certainly, yoga does introduce some resistance training, but maybe working with some weights or with a trainer would be beneficial for her. And again, all that we're talking about here, the lifestyle medicine prescription, is going to benefit each and every one of these chronic diseases. Is there a large randomized clinical study in Parkinson's disease and lifestyle medicine applications? No, but what we do know is that each one of these parameters that we've discussed, these 6 spokes on the lifestyle medicine wheel, have been shown to reduce risk of chronic disease and to improve quality of life.
Thank you. We heard from Heather, who said, Dr. Stancic, have you had any patients with myasthenia gravis that were able to improve their symptoms or reduce or eliminate their medications?
I haven't personally had myasthenia gravis patients, but again, not to sound like a broken record, all aspects of lifestyle, when we optimize them, they're going to serve that patient, regardless of where they are in regards to their managing their disease. But myasthenia gravis is a disease that does require treatment with medication.
Okay, got it. Thank you. Arlene said, how do you overcome multiple abdominal surgeries, knee replacements, and a hip replacement? I'm guessing Arlene is saying that she's been through all of that. She's saying,
Yeah.
but I am moving. I have so much for material now in my body. I don't know where to start. My concentration has been on my gut and diet. Any guidance?
Well, it sounds like she's been through a lot, and having multiple chronic diseases and multiple surgical procedures does complicate things. But again, including a whole foods plant-based diet is going to affect the makeup of the microbiome, right? And we know how important the microbiome is. And we're learning so much about it in the past several decades. When we eat a diet rich in fiber, we're going to enhance those good bugs in our gut, and those good bugs in our gut in turn will favor us with these very important anti-inflammatory signals that will serve to improve our overall well-being. So I think for her, it sounds like she's been through a difficult time. It's important to be patient and not, I think when we've been struggling for an extended period of time, we tend to want results overnight. And with lifestyle, it's something that you have to do, again, consistently, and it takes time. Folks often ask me, Ocean, how long did it take before you saw benefit with your multiple sclerosis? And it's really important to note that it took some time. It took maybe a couple of years before I saw significant changes, before I was able to put the cane away. And the problem, of course, is that when we start something and if we don't see instant results in 2 or 3 weeks, then we abandon it. And what I would say to her is just be consistent, not only with your diet, but again, addressing all of those spokes that we've spoken to, that we have already addressed, and being patient. And I'm sure that she's going to gain benefit.
Yes, thank you. I'm thinking that a lot of people like Arlene are suffering. There's pain sometimes in life. And how we are with that suffering has an impact. It's a big choice, actually, about where we go from there. And to some extent, we can use suffering to mobilize us to try to do better or make good choices. But there's also, in the serenity prayer, there's like, grant me the courage to change the things I can, the serenity to accept the things I can't, and the wisdom to know the difference.
I love that.
So something about pain, there are times when you're in pain and you can't change it. And then that's where serenity kicks in, I'm thinking. And I'm curious if you have any insights on how to hold those moments of suffering and pain that happen in the journey in ways that are fertile soil for a healthier future.
Years ago when I was going through difficult times and I was experiencing a lot of pain and suffering with my disease, I read a book written by Eckhart Tolle, a book entitled A New Earth. And in one of the segments in the book, he wrote about suffering. And he said something, and it's simple, but it really, it resonated with me, is that we suffer when we resist what is, right? When we push against whatever is happening in our lives. That's what suffering is, when we insist on resisting it. When we accept where we are, it gives us a moment to pause, and it gives us clarity. And I think that's been a principle that I've utilized in my life throughout the course of my life, through all those difficult moments, because I think so much of the suffering comes from like, why is this happening to me? This is unfair. When we just accept it is what it is, and almost perceive it as a blessing that I needed to have this moment in order to evolve in some way, to get to the next stage in my life. If we can almost do that, then it becomes easier and more, and our goals become more attainable. So even when we're having this difficult day today, this too will pass. That's another really wonderful mantra that one could live by. That we're going to get through this difficult moment, and there are better times ahead. And so I realized it's easy to say when we're not in the midst of a difficult moment, but it is something that I've utilized in my own life. And it's really served me quite well. Yes.
I'll tell you one other frame. My dad came up with this when he was a kid. He was going through some really tough times, and he had this thought, there's a certain amount of suffering I'm going to experience in my life, and I'm getting a whole lot of it over with really early.
I love that. But it's true. And think about it in your life, right? Those periods of suffering have played a role in your evolution and ultimately have borne fruit. My diagnosis, that day when I was diagnosed, I thought it was the end of my life. I was done. I went through all those stages of anger and like, why is this happening to me? In retrospect, I can look back and say that difficult moment, that diagnosis was actually a blessing. And today it's allowed me to really find my purpose in life. And hopefully it's serving others as we have these discussions and empower individuals to take better control of their own personal health.
Yes. Thank you. We have a few questions from Justin, who I believe is working with MS himself. And so he asked, how much of a factor is stress in the progression or reversal of MS? And what has helped you manage stress on a daily basis?
Yeah, I think stress is so big in MS. I think it's kryptonite. It's interesting when you speak to MS patients, they'll often say, because most of MS, like 85% of multiple sclerosis falls under, there's three categories. There's relapsing remitting, primary progressive, and secondary progressive. Relapsing remitting is about 85% when you're first diagnosed, meaning that you have an exacerbation, then you go back to baseline, you get better, and then another exacerbation. So the average MS patient, when I see them, right before they have an event or an exacerbation, it's typically a stressful time. So stress seems to be a trigger. And so for that gentleman who wrote in with the question, who's living with multiple sclerosis, it's so important for him to address streams of stress. So the very things that we've just talked about, practicing mindfulness, meditation, this idea of not resisting what is, in his case, accepting that this is a diagnosis that he's going to live with, but understanding that it's not going to control or manage him, that he can, in large part, manage the disease by optimizing his lifestyle. And of course, I'm sure he has, or if he doesn't have, he should find a good MS specialist that he feels confident with and to help manage that disease.
Yes, thank you. He also asked, how is your approach different from or similar to other doctors with MS, such as Terry Walls and George Jelinek? And is there one element for recovery that seems to be especially significant when looking at autoimmune diseases holistically?
Yeah. Well, I don't know Terry Walls. I've heard about her, but I do know George Jelinek. And I think we're pretty much aligned, George and I. He has a wonderful website called Overcoming MS that I always recommend to patients. And George similarly speaks on the very same topics that I do. I don't know Dr. Walls very well. I think, though, that Dr. Walls is more of a paleo diet, which, of course, I wouldn't be fully aligned with, as I strongly believe that a whole food plant-based diet is optimal because of the fiber component.
Yes, thank you. And then one last question from Justin. He asked, do you have any experience or information on the effectiveness of low-dose naltrexone as an MS treatment?
I do not.
Okay.
Yeah.
Got it. Thank you. We heard from Susie, who said, how big a factor does alcohol play in increasing the chances of chronic disease? My dad drinks a lot every day, and I'm worried if he doesn't make a change soon, this will impact his life long term if it hasn't already.
Right. So alcohol is a carcinogen. Nobody wants to hear that. But so there's really no safe recommended amount of alcohol. In fact, recently the American Cancer Society changed their recommendations. They had previously been aligned with the food guidelines in that 1 drink per day for women and 2 drinks per day is moderate drinking is acceptable. If you're going to drink, I would stay within those parameters, but alcohol is not offering you any benefit, bottom line. No one wants to hear that.
Yeah. Well, some people think that it makes them more socially comfortable and that it therefore enhances their ability to have more love and positive human connection in their life. Do you believe that? And do you think that is sort of balanced against the carcinogenic nature of alcohol?
I think drinking alcohol to take the edge off or to ease into a social situation is probably not ideal. I mean, I'll occasionally have a glass of wine, but I'll drink a glass of wine in a celebratory setting, or because I want to enjoy a really nice bottle of wine with friends. I think whenever we use some kind of substance to change our mood or to help, I don't think from a psychological perspective that that's ideal.
Right. So I guess the point would be, if someone is feeling like they need alcohol to connect socially, maybe there's a deeper issue of where the fear is coming from of social connection. And maybe that's an opportunity for some therapy or for some emotional healing work of some kind to be able to build more confidence, more ease, more, or maybe they're hanging out with the wrong people. And that's the other thing. Sometimes alcohol will make you more comfortable with the wrong people. So
exactly. Well,
if you're really with people that love you, that get you, that are champions for your well-being, then maybe you'll feel that and it'll be easier to connect.
Right. And then you won't need the alcohol to arrive at that more socially comfortable setting. Yeah, I agree with that. And we know that many of these lifestyle behaviors, you made a good point about who your close connections are, who your friends are. We tend to sort of, good behaviors are infectious, so when our friends are active and eating healthfully and engaging in these optimal behaviors, then we're more likely to do it as well. In fact, there was work done by two social scientists named Christakis and Fowler, looking at data from the Framingham Heart Study. And what they found was if a resident or in this study was obese, then their friend was 57% more likely to be obese as well. And their friend's friend, even somebody who you didn't know, was 20% more likely to be obese as well. So these behaviors, interestingly, from a sociological perspective, are connected. And so if your best friend is an alcoholic and likes to go to the bar every night, then you're more likely to be drinking too much as well.
Yeah, absolutely. And that's probably true with all substances, isn't it? Now
Sure.
we now have more use of cannabis as well, now that it's being legalized in so many states, and cigarettes and all of these things are socially shared often, right?
Socially shared often, and then we're more likely to engage in that behavior if those around us have normalized it and are
right.
also engaging in it.
And on the flip side, when we make a change, we also normalize another behavior for the people around us, because we're
absolutely
social creatures.
Exactly. When we make a positive change, we're going to serve those around us who we love.
Yeah. Andrea said, if someone's eating 100% whole food, plant-based, with just the very occasional dark chocolate and glass of red wine, and practices yoga and meditation daily, but still has chronic musculoskeletal pain, would you recommend supplements? And if so, what might be most effective?
Okay. Well, first of all, let me just say it's okay on occasion to have some chocolate and a little bit of wine. You don't have to be perfect. But again, in this scenario where there's chronic musculoskeletal pain, I would want to learn more about the individual. Again, a good physical exam, blood work to really understand what is happening. And I would not immediately turn to supplements as a solution to the problem without really understanding the entire story. And I bet with a good clinician evaluating her that we might find an answer to her woes.
What kinds of questions would a good clinician ask or seek to answer with Andrea?
Oh my goodness. So Ocean, so when I initially see a patient, so it's a 2-hour visit, and that first hour is just getting to know the patient. So I want to know everything about that individual. Where do they work? What is their family like? What do they enjoy? Regarding their symptoms, where is the pain? What makes it better? There's just so many questions that you ask to get a really thorough understanding of what is happening. And that's how a good clinician with experience can really sort of drill down and come to a solution.
Yeah, thank you. Andrea had one other question. Are there specific recommendations you might make for chronic allergies and asthma for someone who's already eating 100% whole foods plant-based?
Right. Again, it's about understanding what is the causative agent. So it may mean skin testing. It might be a food diary. See if there's something in the diet that is contributing to this. I know these questions are hard to answer because without knowing the entire background, the entire history of the individual, it's hard to pinpoint. Right. But again, it's about finding a good clinician that can do a comprehensive overview and really understand what's happening.
What do you think about food allergy testing?
I don't typically do food allergy testing. I think it's an area that isn't fully validated. And often, at least in my experience, patients who come in with these complaints of allergies, there's typically something else that we can uncover that sort of comes to allowing resolution of the problem.
So are allergies often essentially an expression of inflammation?
Yes.
And so we have to look at where the inflammation is coming from, but it may be systemic. They experience it in their nose or their lungs, but actually it's probably system-wide, and that's just where the symptom's showing up?
Undoubtedly, it's system-wide. It's just presenting in a different way in each and every one of us. So once we can sort of tease out, like, where are we going wrong, addressing all of the aspects and assuring, I mean, I've had patients, for example, who were just really poor sleepers. And once we got them on it, we created effective sleep hygiene in their home. And we talked about how to arrive at that so many of their symptoms resolved. So I think it's so important that the physician that is evaluating the patient does this comprehensive overview to really understand what is happening so that they can prescribe an appropriate regimen.
Thank you. Darlene said in your book, you share your personal story of learning to walk again. How did you find the motivation to keep moving when you were in so much pain? I ask because it's tough for someone with diabetic neuropathy, fibromyalgia, or other painful chronic illnesses to push through pain, even though exercise is a known part of the solution.
Yeah. Well, I think for me, it was my husband and my son. They were definitely part of what gave me the incentive to move forward. But it was starting out really slowly. When I first got onto that stationary bike, I was doing a minute or two and then exhausted and in pain. My husband would carry me off and it would take 10 to 15 minutes to recover. It was always about being patient and understanding that this was not a sprint, but a jog, and this was going to take time. And so when I had that perspective, it allowed me to be consistent. Again, it's all about being consistent, small steps in the right direction. And if we can continue that, this will bear fruit. You just have to be patient.
Yeah, thank you. Last question I want to ask you about. Clara Barton said, I have an almost complete disregard of precedent and a faith in the possibility of something better. It irritates me to be told how things have always been done. I defy the tyranny of precedent. I go for anything new that might improve the past.
Yes.
I know that quote has meaning to you. Can you tell us why?
So much meaning to me. I think it's just beautiful. It's exactly, this is what I feel. And it just captured my personal experience as a physician in this healthcare system, in this conventional medical environment where I keep being told that this is the way things are and this is the way things will remain. And I know it can be better. And so I push against this, what is today the standard of care. And I just love, I've read Clara Barton's history, and I think she's just a remarkable woman who just pushed against the status quo and made a significant difference in the world. And so that's what I hope to do. And so she's an inspiration to me.
Yes, thank you. Well, you're an inspiration to all of us. I thank you so much for your story and for all the lives you're helping. And of course, you're not just helping individual patients, which is huge. You're also a stand for a whole new way of practicing medicine. And we haven't talked as much today about your work to change the way medicine is taught and practiced, but that's huge too, of course. And you're a real leader in bringing lifestyle medicine into the medical field as a whole, where it's so deeply needed. So, Saray, I just want to say thank you.
Thank you so much, Ocean. So lovely to speak to you today.
Likewise. Have a beautiful day.
You too.
When it comes to cancer, Alzheimer's, diabetes, heart disease, and other chronic illness, what really matters isn't how many books you read, how many webinars you attend, or how much you know. What really matters at the end of the day is what you eat and how you live. The science has given us what we need to know. Now it's time for action. It's time to implement and optimize your healthy lifestyle. It's time to get results. It's time to say goodbye to confusion and hello to clarity. It's time to say goodbye to bad habits and hello to good ones. It's time to fall in love with foods that love you back. It's time to join a community that will support you in achieving your goals. It's time for Whole Life Club. Click the link to find out more and to join in now.